So just to, as I said, just to set the scene, the title of my talk is Caring for a Person with HIV, What Have We Achieved and What More Can We Do? This is my conflict of interest disclosure. Now, I thought I would begin, it's up. I thought I would begin by really reflecting on where we have come in terms of antiretroviral treatment. I was a medical student when HIV was first described, and yeah, that's how old I am. Really in 1987, when AZT was introduced for many years, I think many of you in the room will recall that was the only treatment that we had. But shortly, it took nearly a decade before the protease inhibitors and NNRTI was approved. Contrast that really to COVID-19, although, in COVID, in terms of treatment, we still haven't got such great treatment. But as you look through this slide, you can see how far we've come. And of course, the latest in treatment is lenacapavir, FDA approved last year. And how much it has changed the HIV landscape. This is from the UNAIDS report. This from the Path That Ends AIDS that was released just before the conference. You can see from a public health point of view how different the HIV landscape, as I said, is now for the most part. And it's been estimated that slightly more than 20 million AIDS-related deaths have been averted since the scale-up of antiretroviral therapy. And of course, the big news at this conference is the zero risk of sexual transmission of HIV with viral loads of less than 1,000 copies. So when I reflect back to my own sort of clinical practice, really, it really is how far we've come in terms of HIV treatment in the last few decades. But it's also important to remember that, as important as crucial achieving undetectable viral levels is. We also must, look at person-centered care, managing patient in a comprehensive and holistic manner, because there are diverse needs and preferences amongst our patients. And some of these things include the concern about long-term impact of antiretroviral therapy, the contraindications and drug-drug interactions that can still be a concern, particularly in low and low resource settings where late presentation is still, still affecting at least 50% of our own patient population, and concerns around treatment for opportunistic infections is pretty much, and drug-drug interactions is still pretty much front and center for many physicians practicing in this situation. And then you have issues around stigma and fear of disclosure, as also concerns in amongst our patients. So when we look at person-centered care, obviously, for the patients and for all of us providing clinical service, we want to provide a patient with an individual journey towards healthy living. And that can, with the long-term treatment of antiretroviral therapy, mean that we also have to pay attention to, like I said before, increased risk for comorbidities and polypharmacy that some of these patients have. And in a recent study of about 1,400 patients, a significant proportion of those interviewed are worried about the long-term impact of their antiretroviral therapy. And the choices that we make or that we make together could have a great impact in terms of chronic side effect or long-term side effects on their health over time. And as I said before, achieving and maintaining suppression is only the first step to this healthy living that we want to achieve with and for our patients. And so I think many of you in the room are probably familiar with the elevated risk of developing comorbidities and polypharmacy in our patients, particularly those who acquire the infection at an earlier age. Aside from the sort of physical comorbidities, there's also concerns around mental health and substance use. And this is work that my colleagues, Rina Rajasuria, as well as Meng Li, who are in the audience, who look at mental health and substance use. And you can see that there is considerable morbidity around mental health in our patient population. So 39% reported moderate to severe depression, 19% reported suicidal ideation, and 64% used at least one substance in past 3 months, with 62% admitting to moderate to high risk scores. And what this means is also that it impacts on their functional ability and quality of life in relation to the severity of their depression. So when we look at the treatment goals of our patients, it's not only important to be aware of drug-drug interactions and comorbidities, but also in addressing mental health needs of our patients. And so the need to address this and simplify treatment is, is an imperative. And how can we do that? I think this is one study that looked at patient perception in terms of their treatment goals, and in this survey, a considerable proportion of people living with HIV reported suboptimal patient healthcare provider and patient engagement. 63% said that their views were sought before prescribing. A good proportion do ask about the patient's medication concerns, but 61% felt that there was still room for improvement for their HIV management. And nearly a third feared of being labeled as a difficult patient. So in terms of us providing an overall holistic patient, person-centered approach to our patients, it's important that we think about the so-called fourth target, and that's to improve our patients' quality of life as much as attaining the undetectable viral load. And how do we do that? I think here's further work from Meng Li about the importance of learning from our patients, learning from the community. And these are some of the domains that I think we need to start looking into beyond the viral levels alone. And one of the suggestions is, of course, to utilize patient-reported outcomes surveys that have a fundamental role in helping us individualize the care of our patients living with HIV. So, in a very quick summary, before we move on to our other esteemed speakers, healthy living with HIV is important. And people living with HIV are living longer, but face challenges, including comorbidities and polypharmacy. And it's important that we as healthcare providers strive to provide individual care that's tailored to the many diverse needs of patients. Some are physical, some are around mental health problems, or some include both. and tools such as the PROs can inform strategies to help us optimize care and improve patients' healthcare-related, patient quality of life, and which is one of the key the fourth 90 goal that we all strive to provide. So with that, I'm going to, and this is the team from Malaysia I should acknowledge the team from Malaysia in Brisbane having Turkish food, who have done some of that work and beyond in our clinic in Malaysia, some of whom are here in this room. Okay.